Good afternoon. My name is Mary Glenn Rogers, and I am your webinar host today. I work with the Women's Health Branch, and I want to welcome everybody to the school-based weekly Fluoride Mouth Rinse Program webinar. We're glad to have each and every one of you today. I just want to remind everybody, just do some housekeeping, that the audio can only be broadcast through your computer speakers. There is no dial-in number to hear the webinar unless there is an emergency. Okay, so just keep in mind, I need everyone to find a pen, pencil, paper, and write down this phone number. This is only an emergency number, 919-715-0769. If you will, take just 5 seconds and write that down. So if our webinar goes down, your computer system goes kaflooey, Raleigh goes down, you can't see anything on your computer, then you will need to call that number, 919-715-0769, and the webinar will continue only as a conference call because we really wanted you to download your slides for this purpose if something went wrong. So please make sure that you are using computer with speakers. The speakers are turned on and up, and they're not set to mute because that's the only way you can hear the webinar audio. Now, how to ask questions. I think there might be some questions that we'll receive today. If you have any comments, please type that in the Q&A pod to the left of the slide. What you'll do is at the bottom of the Q&A pod, there's an open space. You type in your question, you click the balloon to submit the question, and then your question will be answered at the designated time. If there is a question or a comment about the audio, or you need a speaker to increase their sound, then just let us know. Type that in the Q&A pod. Now, to download slides, look to the left of the slide that we're looking at now. There is a pod at the top left corner called Files. What you would do is to download. Those are actually the slides for today, not these slides here, but the slides for Michael and Debbie. The slides are in black and white, so it won't kill your color printer or anything. But some of these slides I do understand when they talk about the Colorado brown stain, you'll need to see that in color. And if you want to download the color slides, they are on the website. What's in the webinar room is the black and white slides, just for today's webinar. If you need them, you can download it, click on the slides, the file, click download the file, and then just download it to your computer. And remember that there's a lot of information in the FMR manual, and that's on the website, okay? Questions after the webinar, don't forget, hey, you know, if we have more questions, then the webinar can supply, if we have room, then the questions and answers will be placed on the website after December 14th. The archive webinar, and if we have any questions and answers, like I was saying, will be on the website, your OHS website, after December 14th. Now I'd like to give this to Dorana, and she's going to introduce our speakers.
Good afternoon. Today we have Dr. Michael Tensia, who is the East Regional Supervisor with the Oral Health Section. We also have Debbie Greslow, who is a hygienist that serves Region 10 from the Oral Health Section. Mary Glenn, who's been your host so far today. And then this is myself. I'm a health educator here with the oral health section. Tom Parks is our backup host. And Wendy Seymour is our off-site backup host and presenter. So if something goes down here, hopefully she will be able to continue the conference call. So now we will turn it over to Dr. Michael Tintia.
Hey, good afternoon, everybody. I want to thank everybody for joining us. Again, my name is Dr. Michael Tentia, and presenting with me is Debbie Greslow. Today's presentation will focus on how to provide a weekly fluoride mouth rinse program in a school setting. This presentation will include these topics. Much of the information we will present today, by the way, can be found in the Oral Health Section Fluoride Mouth Rinse Manual that's already been mentioned. In the first part of our talk, I will cover fluoride history, fluoride mouth rinse research, policy statements, and rationale. Ms. Greslow will then take over and present the parts on planning, implementation, school monitoring, and collection of class rosters, and appendices. The appendices section of the Fluoride Mouth Rinse Manual includes suggested letters to school officials, information for parents, permission forms, and many other useful materials for developing a program. Okay, let's get started. What we're looking at here are teeth with a brown blotchy appearance that was first called Colorado brown stain by Dr. Frederick McKay in 1901, and we'll talk more about him in a second. Now, his observation of this condition was the beginning of the fluoride story. Dr. McKay opened his dental practice in Colorado Springs, Colorado in 1901, and soon noticed that many of his patients had the brown blotching of enamel on their teeth that we just saw, but no one had described it in the literature of the day, and he was the one who actually called it Colorado brown stain. Now, between 1909 to 1915, Dr. McKay convinced Dr. G.V. Black, who was the dean of Northwestern Dental School and a long-time expert in oral pathology, to collaborate with him to study the Colorado brown stain. And it was actually Dr. Black who coined the term modeling, which you may have heard for this condition. Now, they had two crucial observations through this collaboration. First, they found that this condition did not occur on already erupted normal teeth. Teeth did not turn brown. They were erupted this way, so they reasoned that this condition was developmental. Now, their other observation was that these teeth were very, very resistant to dental caries. So, time went on. Dr. McKay gave a lot of talks at dental societies and other places, and actually became the expert of the day on this condition. And because of that, he was sent a letter from Oakley, Idaho in 1923, when they noticed that children had developed this condition a couple of years after they changed their water supply. So, of course, Dr. McKay said, well, let's stop using that water supply and see what happens. And it worked. In a couple of years, they saw that children with newly erupted teeth did not have the Colorado brown stain. So this was the point in time when Dr. McKay was able to reason that it was something in the water supply that was causing this. Now, time still passed. He did not have methods that were sensitive enough to determine what it was in the water that was causing this. But something happened in 1931, and that has to do with Dr. H.V. Churchill. He was a chemist working for the Aluminum Company of America, and he was interested in finding impurities in the water supply where they were mining for aluminum. Okay, and he saw a report that was presented by Dr. McKay about enamel modeling in Bauxite, Arkansas, where this mining was going on. Crosses this, and of course he was interested in determining any pathology that was happening in an area where they were mining, so he had the drinking water tested in the area. And The Aluminum Company of America, which was later called Alcoa, had a new method of photospectrographic analysis that was able to identify the high levels of fluoride that were in the drinking water. So Dr. Churchill wrote a letter to Dr. McKay, said, I have your answer. This condition is likely caused by high levels of fluoride. Dr. McKay confirmed it by taking water samples from all the other places that had Colorado brown stain, and sure enough, every one of them had high levels of fluoride. So after 30 years of searching, he found his answer. Now, as a consequence of all this, the first dentist, Dr. H. Trendley Dean, was appointed to the newly established National Institute of Health as head of the dental hygiene unit to investigate mottled enamel and fluoride in the drinking water. The results of Dr. Dean's study showed that both the decay rate and the rate of fluorosis dropped sharply as the fluoride level neared 1 part per million and then leveled off. So the two graphs intersect right in the middle of what you see there at 1 part per million, and as a result of that, 1 to 1.2 parts per million was adopted as the appropriate concentration of fluoride in the drinking water in temperate climates for producing maximum decay reduction while causing very mild to mild fluorosis in only 10% of the population. Now, in 1945, the public health community in Grand Rapids, Michigan, decided that this would be a good public health measure for their community. So they became the first city in the world to adjust for fluoride. A 15-year study started shortly after that monitored the decay rate of almost 30,000 school children. And the decay rate in Grand Rapids, Michigan was observed to drop by more than 60% among children born after fluoride was added to the water supply. Since then, many more cities have made the choice to adjust for fluoride in the community water supply. North Carolina, at present, has 88.2% of the population that is served by a community water system receiving drinking water that is adjusted for fluoride. Now, this next slide shows a non-exhaustive list of the national and worldwide health organizations who all agree and support that the use of community water fluoridation is safe and effective in reducing dental caries. The American Dental Association, the American Medical Association, the Association of State and Territorial Dental Directors, and many others agree with this premise. Unfortunately, there are people who do not believe that community water fluoridation is safe and its use is actually a violation of their individual rights. These are the anti-fluoridationists. They are very active and very vocal about the removal of fluoride from the community drinking water where it has been implemented. They also fight to prevent communities from adjusting for fluoride where it has not yet been implemented. This 1988 quote that you see on the slide from Consumers Union, which is an independent testing agency and advocate for consumer projects, states the case for this issue beautifully. And I quote, "The simple truth is that there's no scientific controversy over the safety of fluoridation. The practice is safe, economical, and beneficial. The survival of this fake controversy represents one of the major triumphs of quackery over science in our generation. Scientists, healthcare providers, and their organizations, and local governments who choose to implement community water fluoridation all agree about the safety and benefits of community water fluoridation. Remember, however, the anti-fluoridationists are out there. There are many, many websites on the internet that give false information to people, and these people may choose to target your community for their activities. The North Carolina Oral Health Section does maintain a toolkit with useful information and support documents that we are happy to share with anyone who's confronted by the anti-fluoridationist. Please contact me at the Oral Health Section Central Office in Raleigh if this becomes a political issue in your community, and I'll be glad to help you out. Okay, fluoride and oral health. In addition to community water fluoridation, fluoride has been found useful for preventing dental caries delivered in ways other than community water fluoridation. In toothpaste, in professionally applied fluoride treatments, in prescribed custom gel trays and mouth rinses. And the North Carolina Oral Health section supports all of these and more. Anything we could do to prevent dental caries. Now today, we are focusing on the use of fluoride mouth rinse in a school-based weekly program. Next, we're going to review some of the scientific literature throughout the last several decades that specifically supports this practice. Okay. This 1988 review article by Dr. Steve Adair summarizes the early research on fluoride mouth rinse. And a summary of that literature suggests that fluoride mouth rinse is generally proved to be effective in controlling caries in clinical studies, with caries reductions in North American studies averaging about 30%. Large-scale school studies, however, of mouth rinse programs that were conducted during the 1970s at that time used historical controls, and by that we mean they used caries rates from previous years, and this was at a time when caries rates were known to be declining. So post hoc analysis of the absolute, not relative, caries reductions in these studies showed that school-based fluoride mouth rinse programs at that time were of questionable benefit, and that was from a cost standpoint. Now, the author concludes, after doing his review, that fluoride mouth rinse only be used for patients, and this is for individual patients, who are at an increased or high risk for dental caries, and that specifically school-based programs be undertaken only in communities with a high caries rate in the population. He also comments that fluoride mouth rinses should not be used, for young children until the swallowing reflex is mastered. And this is addressed in our protocols for using fluoride mouth rinse in a school-based weekly program and can be reviewed in the Oral Health section Fluoride Mouth Rinse Manual. Now next is a statistical study using random effects meta-analysis of 34 previously done individual studies from the databases involving 14,600 children to determine the effectiveness and safety of fluoride mouth rinse in the prevention of dental caries in children and factors potentially modifying their effect. Now this was done because the individual studies did not have enough children in them to show a statistical difference in them. But added together with this specialized statistical technique, they were able to show that they were. Now, the studies included in the meta-analysis were controlled trials with blind outcome assessment comparing fluoride mouth rinse with a placebo or no treatment in children up to 16 years of age during at least 1 year of use. The results show that supervised regular use of fluoride mouth rinse at 2 main strengths and rinsing frequencies is associated with a clear reduction in caries increment in children. Now, in the study, it also said that there was no information in any of the studies concerning side effects, but the authors did recommend that this should be addressed in future studies. The next review by Manny looked at school mouth rinse programs in the 1970s and 80s, which were used as an alternative to water fluoridation in many countries, especially where that could not be done. And overall, the caries reduction with the use of fluoride mouth rinse in these early studies had been reported to be 31%. Later studies, however, found that the effectiveness of the fluoride mouth rinses among school children had reduced effectiveness. Currently, all organizations recommend that fluoride mouth rinse only be used in high caries risk individuals above 6 years of age. And of course, it's contraindicated in kids less than 6 years of age because of the high chances of them swallowing the fluoride mouth rinse, where their swallowing reflex is reduced. Now, the World Health Organization suggests that in low fluoride areas, Fluoride mouth rinse programs in schools should be encouraged, but that depends on the cost and the caries status of the community. And when used, fluoride mouth rinses should not replace toothpaste and should be used at a time different than using toothpaste or toothbrushing for its maximal effectiveness. Currently, there are not many studies that have been done concerning school-based fluoride mouth rinse. The next study was done by DeVoris, Roger, and King to try to fill that gap, and the aim of the study was to estimate the caries preventive effects of a school-based weekly fluoride mouth rinse program and to determine whether its effectiveness varied by school-level caries risk. They looked at 1,363 children, grades 1 through 5, and found that there was a trend towards a larger caries preventive effect, 55% versus 10%, in high-risk schools versus low-risk schools. They say a trend because even though there were a lot of kids in this study, 1,363 kids is not enough to show a statistical trend. And finally, they determined their caries risk in this particular study by the mean level of untreated decay, with one or more untreated decays on average in the school children being a high-risk school, whereas schools with less than one untreated decay per child being a low-risk school. Some policy statements on the next two slides, and I'm just going to read through them quickly because we're running out of time in my section. The ASTDD, which is the Association of State and Territorial Dental Directors, supports the use of fluoride mouth rinse programs in school for children aged 6 years and older when exposure to optimal systemic and topical fluorides is low, populations for children are at high risk for tooth decay, and there is demonstrated support by school personnel, and you can use the reference on the slide to get that. The North Carolina Oral Health section recommends and promotes the use of a school-based weekly fluoride mouth rinse program as an effective decay preventive measure. Now, our rationale for this comes from two in-house programs that we did. One was a 1974 weekly fluoride mouth rinse pilot at the Winstead School in Wilson County, where we saw a 34% reduction in the decayed, missing, and filled permanent teeth, which was achieved in 3 years. Now, in 2003-2004, the North Carolina Oral Health section did a statewide dental survey. From this survey, they were able to compare children in the free and reduced lunch program with children not qualifying for that program. And children from the low-income families in the fluoride mouth rinse program had decay rates almost as low as children from higher-income families who did not participate in the fluoride mouth rinse program. And now we are to the second part of our program, and I will turn it over to Ms. Grebslow, who will tell you how to put this program in action in your community. Thank you very much.
Thank you, Dr. Tenza. All right, look at these smiling faces. Let's follow these students who are part of a leadership team that assists the Fluoride Mouth Rinse Coordinator. This particular Fluoride Mouth Rinse program is run by a coordinator that pulls students from class weekly to count and bundle the fluoride mouth rinse doses to deliver to the participating classes as part of a leadership opportunity in the school. So let's discuss fluoride mouth rinse with these students. As stated previously, the North Carolina Oral Health section recommends and promotes the use of a school-based weekly fluoride mouth rinse program. To support and enhance this preventive program, the section has developed a school-based weekly fluoride mouth rinse manual. When the manual was developed, the goal was to create a cookbook, a step-by-step instructional guide. While the instructions section of the manual is about 6 bulleted pages, the appendices have over 40 pages. These appendices are updated, noting the last update September 2015, and have both mandatory and optional forms. This manual can be found on the Oral Health section website. So as we familiarize you in the process of planning, implementation, monitoring, and collection of information, all the information, forms, and documents referenced in this presentation are found in this manual. All right, fluoride mouth rinse. Let's look at the big picture, the who, what, when, and where. We'll delve into the individual steps later. Our target population is 1st through 5th or 6th grade, depending on the grade levels within the school. Kindergarten does not participate, as you have heard before, as their swallowing reflex is not yet fully developed. Each child participating in the Fluoride Mouth Rinse Program must have a permission form. There are 2 options for permission forms: annual, required at the beginning of the school year and discarded at the end of the school year, and permanent, filled out and placed in the student's cumulative folder, only to be discarded when the child leaves the school or when the parent notifies the school in writing that they do not want their child to continue participation. You will notice the asterisk at the end of the bullet. This indicates a required form. You will see this throughout the presentation, and we will review these at the conclusion of the seminar. Teachers monitor the children as they rinse for 1 minute and advise the children not to eat or drink for 30 minutes. Each classroom will have a roster listing the names of the participating children. These rosters have monthly, weekly grids so the teacher can check each week the class rinses with the goal of 28 to 32 weeks. Again, the roster is a required document that needs to be collected at the end of the school year. Just a note, if you choose to implement a fluoride mouth rinse program in the schools where you serve now, students will not be rinsing a full 28 to 32 weeks. But this should not deter you from implementation. Use the second half of this school year to perfect the procedure, so next school year will be smooth and hopefully reach the goal of 28 to 32 weeks. Let's continue with highlights of the Fluoride Mouth Rinse Program. Mouth rinse is a pre-mixed single-dose container of 0.2% sodium fluoride. Flavors are multiple. Cases are ordered by and shipped to the school. As you will see shortly, fluoride ordering will be one of the responsibilities of your most important ally within the school fluoride mouth rinse coordinator. It is important to point and stress to schools that this is a free program that benefits all the children within the school. Safety is needed at all times, so a locked, climate-controlled storage is imperative. Fortunately, a case of 288 individual unit dose cups are 18 by 9 by 7, so a case will not take a huge space. The previous 2 slides of highlights are found in Appendix G of the Fluoride Mouth Rinse Manual and is a handout titled Fluoride Mouth Rinse Works. This is a great handout to use when offering or explaining a fluoride mouth rinse program to school officials. I would like to point out the bottom right-hand corner of this form. You can personalize this form with your contact information. All right, we looked at the big picture. Now let's look at the specific procedure, the how. In a nutshell, what takes place. This is a classroom activity that may be performed anywhere in the school where the class is together, as we will discuss later. When a school commits to participate in fluoride mouth rinse, every classroom with children having parental permission participates. A teacher may not opt out of participating. A pre-mixed single-unit dose cup of sodium fluoride along with a napkin is first distributed to a classroom on the day identified as rinse day, and then distributed to each child who has received parental permission to participate within each class. Children rinse for 1 minute. When the minute is up, children will empty the rinse from their mouth into the cup, wipe their mouth with the napkin, place the napkin into the cup to absorb the rinse, and then place the cup into the plastic waste bag that is distributed with the cups and napkins. The plastic bag is then discarded in the regular trash. As mentioned before, children are not to eat or drink for 30 minutes. Time commitment needed for classroom rinsing is about 5 minutes per week. In an effort to make the procedure as straightforward and simple as it should be, the Fluoride Manual has both forms and paperwork that are required and forms and suggestions for success that are optional to use and can be personalized. All right, pictured here we have a young lady who has placed the fluoride mouth rinse in her mouth. Please notice she could not fit the entire amount in her mouth, and that is acceptable. Notice the napkin is ready, so she can wipe her mouth and then place the napkin into the cup. Well, we've looked at the big picture and the specific procedure. Now let's look at our role and responsibility. Planning. First step in everything we do is planning. We have to look at the schools in our coverage area and assess which ones would benefit most from the fluoride mouth rinse. We have to meet and offer fluoride mouth rinse to the schools chosen. And then, before we can proceed any further, we need our most important ally and liaison within each school, a fluoride mouth rinse coordinator. Let's look at these steps in more detail. Fluoride is good, so let's get the program in all of our schools, right? Not necessarily. It is important to assess the schools in the coverage area. There are certain criteria that should be met when determining what schools are considered high risk and would benefit from such a program. Previously, it was stated children from low-income families in the Fluoride Mouth Rinse Program had decay rates almost as low as children from higher-income families who did not participate in the Fluoride Mouth Rinse Program. So along with targeting schools with students in 1st through 5th grades, we are also looking for schools with a higher percentage of children qualifying for the free reduced lunch program, which can be considered schools with lower income families. Looking for schools with a good compliance is also considered a criteria, but may not be known. Your mentor, oral health section dental hygienist, can assist you with this information. We have forms to assist you also in planning fluoride mouth rinse. They are Appendix C, criteria, and Appendix D, which is shown on this slide here. This is a form that dental hygiene staff use in determining fluoride mouth rinse. One section here shows DMMFT00. This shows the percentage of decay-free, treated or untreated children attending the school. The lower the percentage number, the greater the need. Again, it is important to remember one of the most valuable resources for information like this will be your oral health section public health dental hygienist assigned to your region. Okay, it's important to start at the top and work down the chain of command. Clear communication with all involved is vital for a successful program. Once the list of potential schools are identified, it is important to meet with the superintendent or designee to offer fluoride mouth rinse. Some examples of designees include Director of Student Services, Assistant Superintendent, School Nurse Coordinator, or many more. After the superintendent accepts your offer to incorporate fluoride mouth rinse, a meeting with the principals of the targeted schools should be scheduled. Topics to be discussed include confirming grade levels, acquiring enrollment numbers, discussion of permission forms, remember, either annual or permanent, how we're going to talk annually or how we're going to report annually the fluoride mouth rinse information for parents, and the most important thing, ask for a designated fluoride mouth rinse coordinator. Do not be surprised if the principal asks you to address the faculty or staff in explaining the Fluoride Mouth Rinse Program. The Fluoride Manual has sample letters of introduction or follow-up to a verbal meeting with superintendents and principals. There are other handouts, including the one mentioned before, Fluoride Mouth Rinse Works, in the Fluoride Mouth Rinse Manual that can be copied and distributed to all stakeholders. All right, we mentioned the Fluoride Mouth Rinse Coordinator. As you can see, it does take a team to carry out a successful program. The coordinator, though, is probably the most important team member. Since you cannot be expected to be everywhere every week carrying out the duties, you have to rely on the eyes and ears of the Fluoride Mouth Rinse Coordinator. Teachers monitor the rinsing, but who do the teachers go to if they have questions? The coordinator. Listed here are some of the responsibilities. Appendix K in your manual will give a complete list. Again, you will note the asterisk denoting a required document. The purpose of the safety assessment tool, as listed here, is to examine current safety procedures by reviewing the basic standards of the fluoride mouth rinse operation in a school. It is a good communication tool between the coordinator, principal, and dental hygienist. The tool, along with instructions, are in appendices R and R2. It is important to keep an original and let the school have a copy. Fluoride mouth rinse coordinators identify the day of the week to rinse. They develop a plan to distribute the fluoride mouth rinse, just as you saw our leadership team. There's a plan there to get it to the classrooms. The fluoride mouth rinse coordinator assures that fluoride mouth rinse is kept in a safe place. They assure that the classrooms are participating each week. And the fluoride mouth rinse coordinator orders the fluoride mouth rinse and maintains an inventory. Who better to know what is needed at the school and what the storage capacities are? The fluoride mouth rinse coordinator. So orders can be placed using form Appendix Q, and they are sent to central office via email or fax. Martha Taylor, dental hygiene consultant for the North Carolina Oral Health Section, places the order, and then when the coordinator receives the packing slip, he or she will check for damage, check for quantity, sign the packing slip, and get it back to Martha so the invoice can be paid. All right, so here we have children rinsing. This particular classroom, for instance, the children are seated. Other options may be standing, playing Simon Says, marching in place, or another easy activity that can distract the children from counting 1 full minute. The North Carolina Oral Health Section has on our education webpage an order form for a fluoride mouth rinse educational packet with activities students can do while they are rinsing. Just for your notes, it's Appendix DD. Implementation. When the planning stage is complete, we are going to implement. The first document to review is Appendix I, which is the North Carolina Oral Health Section Fluoride Mouth Rinse Guidance for Schools. This 3-page document is a good review for the hygienist and is good to give to everybody who is working with the Fluoride Mouth Rinse Program. Information includes background of the program, all your forms needed, the procedure, responsibilities, and safety. Before we can go ahead and meet with the coordinator, we have to order the necessary paperwork, which include permission forms, annual, permanent, English or Spanish, safety assessment form, which we already mentioned, the pre-mixed unit dose of fluoride mouth rinse, ingredient list, and a misuse protocol. A note about safety. Swallowing a single cup of mouth rinse is not harmful to the child. As a matter of fact, in the Fluoride Mouth Rinse Manual, there is a document called Fluoride Mouth Rinse Consumption Amounts, which states a 6-year-old with an average weight of 45 pounds can safely tolerate 16 doses. Now, we're not encouraging that, and we don't want that, and it is Appendix T in our manual, but it is there just to ensure and to show the safety of the fluoride mouth rinse. While Appendix K lists the fluoride mouth rinse coordinator duties, Appendix L includes suggestions for creating and providing a fluoride mouth rinse coordinator notebook to have handy in hand when you go to meet with the fluoride mouth rinse coordinator. As part of implementation, we need to check with the fluoride mouth rinse coordinator periodically during the school year to troubleshoot problems, confirm rinsing is being completed on a weekly basis, and confirm ordering and packing slips are being sent to Raleigh. As you can see, the fluoride mouth rinse coordinator takes on the bulk of the responsibility once the program is planned. Here is a screenshot of that fluoride mouth rinse guidance for schools. Again, it's in the manual. All right, so let's go to the second part of this slide. You've implemented the fluoride mouth rinse program. Midway during the year, you're going to ask the coordinator to provide you with numbers of students rinsing, and you're going to check as needed. Then at the end of the school year, you're going to collect the fluoride mouth rinse rosters. There are certificates for participation and recognition in the fluoride mouth rinse manual. You may choose to do that. You will file the permission forms in the appropriate places. If it's annual, the garbage can. If it's permanent, the CUME folder. And then there's you have the ability to evaluate the program. Now, moving back up to the top of the slide, at the beginning of the next school year, things will already be in place. You just need to order the new forms. You need to update any materials and review any changes. You just review with the coordinator. You have an annual reminder for parents, like we mentioned at the beginning of the program. Hey, we're doing fluoride mouth rinse again this year. And then you're ready to rock and roll. You've established the program, and it's going. At one school in our state, the fluoride mouth rinse is distributed by the leadership team, remember? Under the guidance of their teacher, this group is counting out the fluoride packets and delivering the packets to the teachers within the school. I promised you this form toward the end. These are the required forms. You've got your permission forms, the classroom rosters, the safety assessment tool, an inventory midway through the program. You have to order forms using an appendix and your packing slips and the annual reminder for parents. So there's really just a few forms that you absolutely have to do. Some key points, which you probably can tell me by the end of this webinar. The fluoride manual is a step-by-step instructional guide. The coordinator is the liaison between you and the school and takes on the bulk of the responsibility of the program once it's implemented. The fluoride mouth rinse program is provided at no cost to the school system. The supplies must be ordered through the North Carolina Oral Health section. Safety is essential at all times. And your North Carolina Oral Health section public health dental hygienist assigned to your region is a valuable resource. Remember, the appendices have more than 40, but all these were created to make the process easier. They're continually updated. Forms in bold and italics are not optional, and we have certificates of recognition and participation included. So, here are our children again. They're happy. They're enjoying the leadership role of packaging fluoride mouth rinse, and all the children in the school will benefit from the fluoride mouth rinse. Thank you.
Okay, I guess it's a shy group. Michael and Debbie, we don't have any questions yet. It was quite a bit of information. If you will, please type any comments or questions at the bottom of your Q&A pod in that open space. And then when you type the information, don't forget to click the little cloud, the button to the right of where you typed, and that will send your question to me, your host, Mary Rogers. No one else will see the question until it's answered. So this is your opportunity to, just clarify some things with Michael and Debbie. Michael and Debbie, while we're waiting for questions, is there anything else that you'd like to expand upon or just make sure we reiterate?
Well, I think we provided quite a bit of opportunity or information, so I imagine it takes a couple seconds for people to digest everything. But I want to just stress everything is in the Fluoride Mouth Rinse Manual with all the appendices straight step by step.
And that's listed on the OHS website on the training page, I believe it is. I know we've got some shy dental hygienists and dentists out there. Come on. Type a question. I dare you. It'll be all right. Michael, do you have anything to add?
Well, no, I don't. There was a question that had to do with school nurses questioning whether areas that are fluoridated needed to have fluoride mouth rinse that I was made aware of. I don't know whose question it actually was, but you just have to go back to basics and understand why you're doing fluoride mouth rinse for. It's as if you're the doctor treating a community. If a community, school, any place has a high rate of dental caries, you want to do something about it. You want to prevent it in some way. Fluoride mouth rinse is a cost-effective and very effective way to take care of it. And it is an adjunct to community water fluoridation.
Thank you. And we do have some questions. The first question is, what happens if the school would like to continue the program after the grant ends?
They, of course, can continue the program after the grant ends. This is a state program. And the oral health section will provide the funding.
Okay, great. Thank you. And the other question is, do you ever do a school and not do all the grades like 1 through 5? And then the second question to that is, would you only do first or second or third if that is all the school would agree to?
No, when a school is in the Fluoride Mouth Rinse program, everybody who gets a permission form from a parent that wants it gets the Fluoride Mouth Rinse.
The next question, where can we access a list of counties and schools that already have the FMR program implemented?
I believe we have a database in the central office where all you have to do is call the central office, Martha Taylor in particular, and she could give you that information. And your mental dental hygienist could point you in that direction and help you out with that.
Wonderful. Now, what happens if the school would like to continue the program after the grant ends? I think we had that question again, and just want to clarify that and be real clear about it.
Yeah, it's pretty much the same answer as last time. The oral health section will provide the funding for the fluoride mouth rinse, and of course the school can continue.
Okay, thank you. Is there a limit to the number of schools which can participate in each county?
At this point, all qualifying schools can participate.
Okay. Uh, Catherine, if you can send me more information about the comment that you wanted Dr. T to repeat so we can direct him a little bit more specifically. We need some specifics. Just add that to your question area. We'll go on to the next question while we're waiting. What is the due date for the chosen schools?
Targeted schools should be turned in by January 8th, which would be at our next webinar.
And for this grant, do we try to start implementation during this year, or do we get this set up with the plan to start with next school year?
No, either one is just fine. Yeah, remember that you have to get permission forms back from the parents, and it might take some time to get those.
Okay, great. Becky wanted us to repeat the answer about the schools who may have community water fluoridation but have the high risk caries risk and history. And we are recommending fluoride mouth rinse.
Yeah,
And I can repeat.
we're using fluoride mouth rinse even in communities where the water is adjusted for fluoride as an adjunct preventative for dental caries. So if you have identified schools or areas with a high caries rate in the school children, fluoride mouth rinse is appropriate for them. And fluoride toothpaste?
Okay. And our last question, so we're getting down to our last questions. Please, get in there and go ahead and type them in so we can go ahead and address all your questions during the webinar. How to respond to a school nurse who asks about fluoride already being in the water? I guess, how do they respond to a school nurse who asks about fluoride already being in the water?
If I may, I have had a school nurse ask that question. Well, we have fluoride mouth rinse in the water. Why do we need it? And the sarcastic side of me wanted to say, and how's that working for you with your decay rate at 25%? But instead, I just mentioned their decay rate. Even though the children have community water fluoridation and access to it, their decay rates were high to warrant it.
Thank you. And to clarify, the school is either all in or all grades out except for kindergarten, correct?
Correct.
Okay, the next, for schools who plan to continue after the grant, who's responsible for following up?
The public health dental hygienist that's doing the program with that county.
Would participation in the program be contraindicated for any student that has an identified case of severe fluorosis? If not, are there any contraindications?
Once fluorosis is occurring on a tooth, that's it. You can't really change it except cosmetically in the dental office with laminates and other cosmetic procedures. The additional fluoride washing over the teeth as a rinse or even in the community drinking water is not going to harm that child.
Okay. And we've got time for one last question. There are some questions that we won't be able to get to, so just remember, all the questions, whether they were answered or not, they will be on the website after December 14th. Okay, they'll be on the website right along with the archived webinar link after December 14th. The last question. So to clarify, we should have the schools identified by January 8th, or actually started the process of speaking with the superintendent or designee, principals, etc.
By January 8th, we'd like for you to have targeted which schools you want to present to for fluoride mouth rinse.
Okay, I want to thank everyone for getting in those questions, and like I was saying before, we still have a few extra questions. They will be answered and addressed on the website after December 14th. The archive webinar link will be available after December 14th. So, share that with your co-workers that were not able to make it. And I want to ask Sarah if she will provide our closing remarks for the webinar.
Okay, great. Thank you. Guys, thank you so much for participating in the Oral Health Section's first webinar, our Fluoride Mouth Rinse webinar. We have a roster survey on the website. Go there to record your attendance and get your CE certificate. And please know, if you haven't picked up on it before, that this webinar was recorded and it will be archived on our website. So now this is different. So as part of our Oral Health Partnership Grant, each health department did agree to host a school-based dental sealant project, and now is the time to pick the week each dental clinic can have their public health dental hygienist host a project. And this needs to be a week your mentoring hygienist can participate with you. The Oral Health Section has been scheduling projects for the spring already, and we have plenty of time in April and May to schedule your projects. Your mentoring hygienist and you must connect very soon to find a week you can offer to schools. So try to get together sometime in December and pick weeks you can offer to schools to host your school-based dental sealant project. Our next webinar will be on school-based dental sealant projects, and it will be offered January 8th from 1 to 2. Thank you so much.